Hey everybody, my name is Dr. Jason Emer and I'm a Beverly Hills cosmetic dermatologist and liposuction specialist that's here today for episode 4, Ask the Doctor, where we're going to answer Samantha from Arizona's question, and it is, how do I get a more lifted and bigger booty? And I love this question because the majority of my practice is doing body shaping and using fat to increase the size of the buttock. And we all know that buttocks are really popular right now, and getting a bigger, more youthful booty that's smoother, has less cellulite, that's more tightened is something that everybody's looking to get. So how do you get that surgically or non-surgically? In our practice, we're doing a lot of things because people don't want to go under the knife, to give them a better shape, to give them a more round appearance, to give them more lifted booty. We're doing things like radio frequency skin tightening, which is a device externally that rolls over the skin, heats it, and tightens the tissue. And over time, through a series of treatments every 4 to 6 weeks, they get a more lifted, shaped buttock. You can do that on the lateral thighs and the front of the leg to improve cellulite, and we often combine this with an injectable medication called Sculptra. Sculptra is made by a company that produces this product to develop collagen. Over time, when it goes into the skin, it tells the body to produce collagen and give lift. If you use it in the face, it can improve wrinkles and texture. But when we use it on the body, we can use enough of the product to build out an entire buttock, to improve a buttock roll and even improve the cellulite. So a lot of times we'll do that type of combination therapy. We also can do something between surgical and non-surgical, where we do a small procedure in the office called Thermi RF. This is a small probe that goes under the skin with a little bit of numbing medicine. It causes no pain, but it internally heats the skin to create tightening. So you can improve the appearance of the lateral thigh if you have saddlebags, if you have a buttock roll, or if you want a little bit more lifting on the buttock itself. We can do that treatment and combine it with Sculptra to even get an even better outcome. And then we can go more towards surgical. So my specialty is using fat. And we can take fat from all over the body, anywhere you have problem areas, purify it with growth factors, and then inject it to the buttock, and it's permanent. That result lasts, if it's there for 6 to 12 weeks, it lasts forever, and you can then add Sculptra or growth factors afterwards to get an even bigger buttock or a better shape. And that only other option after that is implants, which is a surgical treatment and often has a lot of downtime. So a lot of people avoid doing that. One thing I would say you should never do is silicone injections, which people will often go abroad or in other countries to get injections. It's permanent, but has a lot of long-term consequences. So ultimately, to get this improved booty, we want you to exercise, we want you to diet, but combine that with these non-surgical treatments like external radio frequency, Exilis treatment, or Venus Legacy treatments. Combine Sculptra injections, get those over time to build out the buttock, or go ahead and get that high-def lipo with fat transfer to get a sculpted abs. At the same time, you get a bigger buttock. I'm glad you guys joined me today for episode 4. Stay tuned for more questions on Ask the Doctor.